Hello, and thank you for joining us. The following video is an extract from one of a series of academic Wednesday webinars hosted by the Institute of Economic Affairs in cooperation with the Vincent Centre, University of Buckingham. In this video, we hear from Professor Terence Kealey, who discusses what he sees as the UK and US government's incompetent handling of COVID-19, arguing that public health should be entrusted to independent agencies free of direct government control.
Thank you very much, Said. It's lovely to be here, and I shall obey orders. I shall talk for about 20 minutes, perhaps even shorter, because it's always the Q&A sessions which are best on these occasions. The title of my talk, I'd like to make clear what the title is, and I'm looking at, and I also ought to explain that I've written a paper, that this talk, therefore, is a reflection of the paper, and the paper will be published by the IEA shortly. It's about 3,000 words. So it'll be readily available. And the title is quite a savage title. It's COVID-19, the failure of UK and US government science. So the thesis is that the British and American governments manage the science badly. And there's a solution. I propose a solution as well as outlining the problem. But let me just encapsulate in one little second how I see the problem, just to give a metaphor that one can grab in one's mind. If one imagines that film Jaws, which most people have seen, in Jaws you'll remember there is a holiday resort by the sea, and the shark turns up and starts eating people, and the police chief wants to close the beaches, but the mayor does not. The mayor is more concerned with protecting the economic interests of the merchants of the town. And the mayor overrides the police chief, and so the shark carries on eating people. And that, in a metaphor, is what I'm saying has happened to British and American science. We have scientists who are our police chiefs, but they haven't had the autonomy to say, look, there's a shark out there, we should close the beaches. They've been overruled by the mayor, who in this case is Boris Johnson and Donald Trump. And my solution to this problem is that we make public health science independent of direct report to the executive. We make it more like the central bank, or more like the Supreme Court, or more like many other organizations in both Britain and America that are funded by the government, funded by the state, but see themselves as reporting to the Crown or to the state or to the people or to the Parliament, not simply as reports to the executive. And so I advocate a solution, to go back to my Jaws metaphor, whereby the police chief would have the right to go directly to the people of the town and say, look, there's a shark out there, you shouldn't swim, as opposed to have to report only to the mayor, who can suppress it. So that's the metaphor. And it's a very libertarian message, of course, of freeing institutions from the direction of the state. So I have a paper in front of me here, and I will go through the paper in about a quarter of an hour from now on. So the structure of my talk is exactly as the papers, so that I hope makes it easy for people. And I start off by pointing out that last year, the Global Health Security Index ranked 195 countries' capacities to address a pandemic, only last year. And the two top countries were America and Britain. So an international global register of pandemic preparedness put Britain and America at the top. Probably the two countries that handled it worse, at least amongst the industrialized world, were Britain and America. And the question, therefore, is, why was that? Why, when we should have had everything, did we do it so badly? And I'm not going to go through all the deaths and the diseases, because everyone knows that America has had 100,000 deaths. Everyone knows that we've had 35,000 deaths. And everyone knows that other countries have done so much better. And the question is, what are those countries and why? I'm going to focus particularly on South Korea and Taiwan. South Korea did see in February, towards the end of February, up to 1,000 deaths in one particular day. But basically, South Korea crushed the disease. It never locked down, nor did Taiwan. And now, of course, South Korea and Taiwan go through days of no cases at all. So they've avoided much of the economic damage we've had, and almost all of the health damage that we've had. So what did South Korea and Taiwan do that we didn't do? And to go back to my metaphor, they listened to the police chief claiming there was a shark out there. So the actual facts are, on December the 31st, the Chinese government informed the World Health Organization that there was a new pneumonia around. On January the 10th of this year, the RNA sequence was published, very quick, very impressive piece of research actually by a group in Shanghai. On January the 20th, South Korea reported its first case. The next day, Taiwan and the States reported their first cases, and a few days later, we reported our first cases. So if it's like a race, South Korea and Taiwan, Britain and America, we start off at the same place. We all get the disease around the same time. The difference between the two sets of countries, the Far Eastern countries and the Western countries, is this. What they understood in Taiwan and what they understood in South Korea is one case, but two cases is a pandemic. So the moment, essentially, there was a second case, they knew they had a pandemic on their hands. So as early as January the 27th, just days after the first case, the authorities in Seoul, the South Korean capital, invited representatives of 20 South Korean biotech companies urgently to develop a diagnostic test. So on January the 27th, the South Korean government invited 20 companies to create a test as quickly as possible, because this is the point. If you can test for someone having the disease, and if you can trace all those persons' contacts, you can isolate them and only them. You don't have to close down the whole of society. You can focus on just the individuals with the condition. Test and trace, we're all now very familiar with it, but this is no mystery to epidemiologists. By February the 10th, South Korea had tested 2,000 cases on that day alone, and thereafter, South Korea's testing became in itself a form of pandemic or epidemic. South Korea was testing everybody. And the moment someone expressed the disease, he or she was isolated or quarantined, their contacts as well, and very quickly, South Korea crushed the disease. Very similarly, Taiwan did almost exactly the same thing. Let me just read what the president of Taiwan said. Last December, when indications of a new contagious respiratory illness began to appear, we began monitoring incoming passengers from China. In January, we established the Central Epidemic Command Center to handle prevention. We introduced travel restrictions and quarantine protocols. Upon discovery of the first infected person on January the 21st, we undertook rigorous investigative efforts to track travel and contact history for every patient, which is how Taiwan had very few patients indeed, and certainly didn't have to close down. Now compare that to America and Britain. I start with America. Let me quote from an article written by a biochemist for The Atlantic magazine, describing the first few months of the pandemic in America. It's a depressing story. The Centers for Disease and Control and Prevention developed, that's the government agency, developed and distributed a faulty test in February. So the government created a test in America, not as in South Korea, 20 independent companies. In America, it was the government that developed a test, and the test failed. Independent labs then created alternatives, but they were mired in bureaucracy from the FDA, the Federal Drugs Agency. So when the failure of government science became so obvious in the States, the private sector stepped up, only to be crushed by another government agency, the FDA. And to quote this biochemist, the testing fiasco was the original sin of America's pandemic failure, the single flaw that undermined every other countermeasure. The point is this: if you do what South Korea or Taiwan did, you never get to the conversations we're now having about whether lockdown or rising the lockdown, or should we do what Sweden does. If you can get there really early and stop the pandemic before it starts, you don't get into the situation that so much of the Western world has got into. America got there because its government science failed, and then the government stopped the private sector from succeeding. And we have a very similar story in America, in England, sorry. Let me quote from the German scientist who led, Germany was much more successful than Britain. Let me quote what the German scientist said about our science in Britain, or England technically, but it's actually Britain. Public Health England, he said, was in a position to diagnose the disease very early on. We, the Germans, worked with them to make the diagnostic test. But rollout in Germany was driven in part by market forces, which made it fast. And that wasn't the case in the UK. So what that means is, actually, Public Health England came up with a test very quickly. But Public Health England stopped the private sector from scaling up to the population. Very hard to understand why. There are a number of explanations why that should be, but the one explanation you should not believe is the answer, the explanation given by the Secretary of State, Matt Hancock, who said something very misleading. He said, we have the best scientific labs in the world, but we did not have the scale to develop mass testing. That's not true. The British biotech and pharmaceutical sector is much bigger than that in South Korea, actually. But they weren't, in fact, asked to upscale the tests, the private sector, until April the 1st. So again, April the 1st, by then the pandemic had taken off. Again, government failure. The government failed to ask the private sector to do what the private sector can do so much better than the government. So why is it that the British and Americans failed where the South Koreans and Taiwanese succeeded? And here, I think, we simply look to the statements that the leaders of all four countries made, because those statements, I think, tell us much about what happened. So the president of Taiwan said that her country's success can be attributed to the joint efforts of government and private companies, a partnership we have deemed Team Taiwan. And as I've illustrated, and of course there was a similar Team South Korea, that's not what happened in Britain and America. So let's just go through the statements of these leaders. So the South Korean leader says on January the 30th, we need measures strong enough to the point of being considered excessive. This is January the 30th, where there are only a handful of cases. In Taiwan, we're taking same day, we're taking all requisite steps to minimize the risk of pneumonia caused by the new coronavirus. These are statements at the end of January. Now let's see what Boris Johnson said in England. On February the 3rd, he condemned the bizarre autarkic rhetoric of South Korea and Taiwan. He said the risk that new diseases such as coronavirus will trigger a panic beyond what is medically rational, that's the risk. Responding, overreacting to this new virus. And then he says, humanity needs some government somewhere that is willing at least to make the case for freedom of exchange. Some country ready to take off its Clark Kent spectacles and leap into the phone booth and emerge with its cloak flowing as the supercharged champion of the rights of the populations of the earth to buy and sell freely amongst each other. He was the mayor in Jaws who said to the police chief, you're overreacting to the shark. It's more important that the traders on Main Street continue to make profit. And to hell with your nonsense and the shark. He goes on to say, Boris, as late as March the 3rd, I'm shaking hands continuously. I was at a hospital the other night where there were a few coronavirus patients, and I shook hands with everyone, you'll be pleased to know. And on March the 7th, this is 5 weeks after Korea and North Korea and South Korea and Taiwan had basically gone into action mode, he went to a rugby match at Twickenham with his pregnant girlfriend, where there were 81,000 people packed in the stadium. Donald Trump, much the same. Initially, in January, he said, I quote, coronavirus is totally under control. One person coming in from China, we have it under control. It's going to be just fine. Then throughout the whole of February and half of March, he congregates vast rallies of supporters to whom he explains, and I'm quoting his own words, COVID was no more than the flu. It will suddenly disappear. Its hyping represents only a conspiracy between the fake news media, the deep state, the swamp, and the Democrats to weaken the stock market and thus damage his chances of re-election. He's the mayor saying, to hell with the police chief and his worries about the shark. I have a stock market to protect, and that is more important. And in a sense, this is the difference between Britain and America and South Korea and Taiwan. Our leaders were concerned about the stock market and about being Superman and trading, and they were not concerned about the virus. Adam Smith and my talk, my paper, absolutely cites throughout Adam Smith and what Adam Smith told us we should do in a situation like this. So Adam Smith is seen as the great protagonist of the free market, and of course, he believed in free markets, as do many of us, of course. But he also said there were such things as public goods, which he described, and I won't quote his language because it's archaic now, but he says there are such things as public goods, which are of great benefit to society, but which no individual will ever be able to pay for. And he absolutely, in moral sentiments, states that public health, he doesn't use those words, but it's in the paper, is exactly one of those things called a public good. Adam Smith would have said, looking after the public health is a very important public good. And he goes on to say, if I can just get to it, well, I'll come on to what he says in a minute. Let me just go down here. I want to come back to Adam Smith, but I just want to go back to Trump and Johnson just for a moment. Not only did they deny the risk in the early stages of the disease, but Trump in particular had actually taken away the measures by which we could have anticipated the risk. It's not good enough to say, how could Trump or Johnson have anticipated this? Barack Obama had placed within the National Security Council of America a pandemic unit, which Trump abolished on the grounds that we didn't need one, even though he himself had been very frightened by Ebola a couple of years earlier. So what I'm trying to illustrate here is we have political leaders in Britain and America who not only don't want to know about the virus, but have actually actively removed measures that could have protected us. Boris Johnson, 5 weeks in a row, did not attend the COBRA meetings. Just when the crucial decisions were being taken, Johnson wasn't there. He didn't think it was important enough. Compare that to Winston Churchill. Churchill was a great believer in science. And there's that famous memo he sent when Turing, the famous Turing, the computer guy who broke the German codes, when Turing and his friends at Bletchley Park sent a message to Number 10, Churchill famously wrote back, "Action this day." The long list of needs that the scientists at Bletchley Park needed, with a demand that those needs be met that day. Compare that to Johnson not being at COBRA for 5 weeks in a row. It's a very big difference between the way Churchill and Johnson handled that. So the question therefore is, why? Why do they handle it badly? And what can we do to stop it happening again? Because it's always a mistake to focus on individuals. What we're dealing with here is a systemic problem. There is something wrong with the way the West handles science as compared to how the East handles science, and that's what I want to come to now. But I want to point out that there have been precedents, and the most interesting precedent was Robert Walpole in 1721. And we all know about that because the following year, that great book by Defoe, Diary of a Plague Year, was published. But what people don't know is that Defoe's book was actually written at Walpole's instigation to defend what Walpole was doing, because in 1721, there was a plague in Marseille. And Walpole wanted to introduce quarantines. He actually wanted to stop any foreign trade at all, basically, in Britain, until the risk of the plague from Marseille had gone. And he won the vote in the House of Commons, but the threat was he would lose the vote in the House of Lords because the House of Lords was absolutely owned by the City of London, and the City of London did not want quarantine. They wanted to open the beaches to the shark. But Walpole, unlike Johnson and unlike Trump, stood up to them, and the quarantine was introduced, and that's why no one's ever heard of the Great Plague of London of 1722, because Walpole stopped it. The point is this: there is a level at which Trump and Johnson don't actually believe in the public sector. They believe in the private sector. Well, I believe in the private sector too. I believe very strongly in the private sector, but there are such things as public goods. And when you do have a genuine public good, it's important that we protect it. So I'm going to come up now with my final solution. What do we do in the West to stop this recurring again? And the answer, I think, is fairly straightforward. If you talk to the scientists, especially the epidemiologists, I'm not an epidemiologist, I'm a biochemist, but I can talk to epidemiologists, they're perfectly nice people. What they will tell you is, we've had MERS, we've had SARS, we've had Ebola. We all know that there are more and more diseases spreading through the West and the world from animals. That's where they all come from. What we haven't been able to do in the West is articulate those concerns directly to the people. So we believe, in the example, in the public good in Britain and in America of a central bank. The central bank is funded by the state, but it doesn't report to the minister, to the chancellor of the exchequer, or to the treasury. The central bank reports essentially to society. It's an independent agency. There's actually a technical term in America for this, an independent federal agency. It's not owned by any department. And the chairman of the Federal Reserve, or the governor of the Bank of England, has a duty to speak directly to the population. And when he or she speaks to the treasury, or to the chancellor of the exchequer, they're speaking as equals. And the buck stops with the chairman of the Federal Reserve, or the buck stops with the governor of the Bank of England. He is accountable for his failures or her failures, and therefore they speak openly and publicly when they feel the need to do so. It's the same, for example, with the Supreme Court. The Supreme Court is paid by the taxpayer, but the Supreme Court justices don't report to the Minister of Justice. They're autonomous, and they essentially report to society at large, to the Crown, to use a British metaphor, slightly different in the States. If you look at the agencies that failed, Public Health England, the Federal Drug Administration, the FDA, the CDCD in America, the Central Control Disease Committee, whatever it's called, they are all owned subordinate institutions of a government ministry. The men and women who led those organizations had no autonomy. They were, I'm afraid, like the police chief in Jaws. They were only allowed to report to the mayor. They were not allowed to go public because that was breaking the terms of their contract. So what I'm saying, to conclude, is this. We need important public functions like public health and public health research not to be constrained by reporting to government ministers, but like the Supreme Court, or like the Bank of England, or like many museums, many universities, they should be autonomous and independent, funded by the state, but accountable to society. And their chief executives and chairmen should absolutely understand, as they would under such a situation, that the buck stops with them. They are accountable for what they do or don't do, and they can then have a dialogue with the government minister as equals, free of any concern that they are breaking the terms of their contract of confidentiality. So to conclude, we failed, and we have failed badly. Anyone who thinks that Britain and America have done well with the virus is living in some cuckoo land. We failed, and we failed badly. And I argue that one major part of that failure was that the scientists who knew what to do were not allowed to say what they wanted to do because they were subordinate to the mayor rather than to the police chief. Thank you very much.
Thank you for watching. That was clearly a thought-provoking talk from Terence. and it raised a number of questions on the effectiveness of public health agencies during the coronavirus pandemic. For more details of our online content, please subscribe to our YouTube channel, IA London, follow our podcasts at Podbean, or look at our website, ia.org.uk. And to help us keep providing free content during these tough times, please do consider making a contribution, no matter how modest, by donating online at ia.org.uk. Thank you for watching or listening today.